Hello, and welcome to another episode of Cut to It, the nurse podcast covering a lot of things OR, but we are open to other topics as they come in. I'm Dr. Rosemary Babo. I'm an operating room nurse, global medical, clinical education specialist, really interested in delivering the best evidence practice to you via this podcast. And I'm delighted to be here with my co host.
Yep, Marianne Sanford, also operating room nurse, also in global clinical education and clinical practice. I love education, and we're hoping today that both of us can bring you excellent clinical evidence and education that will improve your practice.
Well, great. So today we're going to go ahead and page Dr. Logarithm, algorithm, a logarithm. So today we're going to page Dr. Logarithm and see how AI in the operating room and surrounding areas and specialties impact us today. It's been a big topic at AORN this year. It's also been something I heard at the World Health Expo, and how we are in our infancy of integrating AI into our practice, and yet we've been doing it for a lot of years. So, Marianne, do you want to start us off by what you're finding in the literature?
Sure. I wanted to give an anecdotal point about AI. I'm just giving this to Rosemary. We didn't talk about it before. I had met somebody. Oh gosh, it's probably 6 years ago now. That was showing me early AI. He's a what they call a white hat internet person. So he looks for opportunities to increase knowledge and increase the internet usefulness. And he showed me early version of AI, and it was you asked a question just like you do now, and he said, "Go ahead, ask it a question. It's going to deliver a response to you or write something for you." I said, "Great." And I said, "Well, there's this singer, this musician that I really like. Give me a story, like a background, a history about this musician." It was stuck. It couldn't come up with anything. Some of it was wrong, clearly. And so my point in that story is, look at how far AI has come in just a 6-year period, because this person was working on it in its infancy for sure. I'm impressed with the speed in which it's improved.
Yeah, definitely. So,
So
what
one
ab
Go ahead.
yeah, go ahead.
So one of the places that AI was adopted fairly early was radiology.
Mhm.
Now, radiology is sort of an interesting way to start, but it makes sense because you can train, right? You have to train AI, and it's only as good as the data that it has access to. You can train AI on different models of clinical findings. So, for example, you could probably dump 5,000 examples of a breast mammography, right, to look for calcifications or a tumor, and then have AI review mammography image and present an idea to the radiologist of what the AI thinks it is. Now, the radiologist still has to look at it. So, but they have a basis in fact to say, okay, in this upper right corner that we see something and it's potentially just calcifications. So it's interesting that they were early adopters. However, there are over 1,000 radiology AI tools. And that's a lot, right?
Yeah.
Again, think of that 6-year period. They're cleared for use, but fewer than 2% of radiology practices actually use AI. So they were interested in it, but not necessarily trusting it, I would say.
So that was what I was thinking. Is it that they don't trust it? Do they have some other inhibition? I do know that when we were implementing the new charting, going from paper charting to the system, we had physicians that would not use it, literally not use it, send the residents, and they got in trouble because they needed, as an attending, to sign off on what was going on. And that was just charting. That was just even before AI came into, I mean, AI's been around forever, but it's just at this level, it was just the charting, the population of different things that you could check off, and they were against that. And to me, that was just crazy. So there's an
Mm.
unwillingness to change, and I wonder if that plays into it, because I or is it an ego? part of it. And I will talk about that a little bit from the nursing perspective. On not that nurses have egos, but it is something that you really want to safeguard against. But go ahead and continue with what you were talking about, Marianne, and I'll get back to the
Yeah.
nurse perspective.
One of the other things is that when there's a failure in AI implementation in healthcare, the literature talks about the most common reason is because it may have been validated in a research capacity, but it doesn't necessarily reflect true clinical use. And so
Mhm.
that's something interesting to us as well. That again, you can train it as much as you want. That doesn't mean it's actually going to produce good results or accurate results. It might still give false information, as it does when you're just asking for ChatGPT a question, right? It might be a recipe and it still comes up with sort of weird things. So, very, very interesting. And when we talk about the surgeons and the information that like you want to train AI to think about, there was a good phrase I saw in one of the clinical publications that surgeons and other clinicians know more than they can tell. What does that mean? It means a surgeon or a clinician can't articulate all of the subtleties of what they're doing. Every surgical procedure is different. Every clinical situation that needs attention is different. And so there isn't a way currently to train AI models fully for surgery specifically.
That's very interesting, and it brings up, something too about the nursing, and it's just that it's not that they don't particularly have, an aversion to AI, they just don't trust it completely, and as you said, it's a part of being there, it's part of feeling, it's part of understanding, it's part of the intuition and just being human that this device cannot capture. But I think a lot of it that I find to be very good is that it can capture things in the moment because right now what we're doing is we're documenting after the fact. I mean, yes, there is some charting as it goes along, depending, if you're a circulator or whatever, um, and even past that, but they're still dictating things after the fact, and this is something that they can capture. In fact, I just had my annual physical, recently, and she asked me, can I record this? And
Yeah.
I thought it was great because, you're not relying necessarily on your memory of what happened. And then you add fatigue in and that, things start to look the same after a while. And it does pick up on a lot of things. The nurse or clinician is the firewall. They have to make
Mm,
sure that what is in that note is correct. So people who think, and I know this is a real thing, they think, oh, my job's going to be eliminated. No, your job should be enhanced by the AI. And it is a tool, as you were saying, Marianne, on how to perform more accurately. And even if radiologists aren't jumping at using it, I heard one recently on Doctor Radio, and he's like, it's a second set of eyes. It doesn't mean that it's, something I'm going to completely sign off on, but, there's, it's a, it's a tool that we can use.
mm. Yeah, there are a couple examples of AI in the operating room that I read that I found fascinating. So there's an AI system currently in limited use that takes a video of
Mm,
the entire operating room. So everyone in the case, anesthesia, circulator,
right.
scrub, PA, who, it doesn't matter, and watches the procedure and it is evaluating for the performance of all the people in the OR and looking for ways to have improved care for the patient. So, early findings, and you may or may not think this is great, but early findings saw that there were 8 minutes, an hour wasted in the
Mm,
operating room based on what the AI saw. So some of the things that it also saw were excessive traffic in and out of the OR, and we're always talking about that,
yes.
right? Distraction and which we've talked about, right?
Yeah.
And infection risk, which we've also
Mm.
talked about. So now you have
Go
AI
back to those
screening.
podcasts. You haven't watched
Right,
them.
good podcast, go find 'em.
Yeah.
And, the AI is now evaluating that and making suggestions for improvement. It's not criticizing what was done and what it saw, but it is suggesting improvements, and I'm assuming that one of them would be, we really can't have all these people coming in and out of the OR, it's really not appropriate. Um, also with staff reaching into the surgical zone, sometimes your reps, they get a little too close to the drapes, so this would see that, and you have an opportunity to educate for improvement. Um, it correlates the operative actions with patient outcomes, and this is what's so exciting, right? You do have a little bit of a maybe it can be considered an oversight of people being watched by a device and then reviewed by a person, but it's strongly associated with improving patient outcomes, and it's also associated with complications for the patient. So you would identify where a break in technique could have caused a complication. I think that's really exciting. One of the things it also does, I always mention aviation. It's similar to a black box, right? In the planes, and if there's an incident, they look at the black box to hear or to see what was going on with the instrumentation, where the plane was, or whatever. And so that's a record for analysis later. And that's really what this AI program does. It makes an analysis so that there can be a discussion, but it analyzes, it records everything for that. And yeah, is it outreach or is it improved patient outcomes? That's something that people have to weigh when they're considering these systems.
Well, there were 2 physicians that, did a presentation at the World Health Expo, last fall that I thought kinda ties into this. They had AI, and it's, in essence, a black box. They visited different facilities, but yet they didn't have access to each patient's information, which they really wanted to have, that they could see
Mhm.
instead of having to log into the different, entities to track their patients. And it was, I thought it was a great innovation because as they go to different spots and do have to care for different patients, I want my guy coming prepared. And if he's had an opportunity, or she, before they get there, to understand, or not understand necessarily, but get an update on my care that's gone on since they last saw me. I thought that was wonderful, and I wish them a lot of success because I really would like to see that help enhance patient care and timeliness, and even for them, because I know, what did they say? Nursing 20 to 30% of their time is just done with charting, and that would really help them. And I do think it helps them. My sister-in-law, they have AI that they use for the charting, and she thinks it's wonderful. And um, she's older than I am, and it didn't have that learning. I'm just saying, because there is part of that too, and studies support this, that depending on your age range, and we've mentioned this, I think, too, mentoring can go up. It can go from younger to older as well, because some of the people aren't as adept at the AI and what features are available. So I just mentioned that because she loved it. It really helped her in her day. So watching out, like you mentioned, a black box to get really the full view of what's going on, cost savings, efficiency. Wouldn't that be wonderful to really utilize it for that? And I'll say a couple more things that I think some key innovations are just intraoperatively. AI can give predictive alerts and support the decision. Not that it's always right, but either are humans. It's a science, as we know. In robotics, for precision and efficiency, and using virtual reality and simulations for training and reducing errors in that way. We always are good proponents of education. And wearables, continuous patient data. So, your physician, or, surgeon, they will be able to know what is actually going on, because you have a wearable, or even 3D printing, patient and specific implants for that patient.
Yeah, there was one other AI system that I stumbled across. It's an AI guided camera holder,
Hmm.
where normally you would have an assistant or a scrub holding the camera. This is designed to assist like a single surgical person in procedures that normally take two. So I found that to be really fascinating. It stabilizes the camera. We all know there's some shakiness with the camera, no matter how good the person is. What I found fascinating with this discussion is there's no mention of how do you like calibrate it? Do you hold it to a certain tissue and say, oh, this tissue over here is the liver or here's the large back? Like I just found that sort of lacking with the information. It's actually a very interesting concept because now you free up a set of hands and of course they would become that person would become more efficient. So there's a
Yeah.
lot going on with AI for sure in the operating room. And we hope we've given you just a little taste of it and what might be to come.
Yes, don't be afraid of it. Lots to learn, and as Mary Ann said in the very beginning of this episode, it's what you put in, and that's how it helps it learn. And that's why we're doing these podcasts too, to help you learn, to bring the evidence. Happy to cover any topics. So until the next time, we'll see you soon.
Great. Don't forget to like, follow, and comment. We really like to hear how you like the podcast and what else you'd like to learn.
Yeah,
Thanks so much. Looking forward to seeing you soon.
go do the count now.